Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of sciatica. Well, what is sciatica? It occurs when one of the nerve roots of the sciatic nerve is pinched. So if you look here on the diagram, the sciatic nerve is an actual nerve, okay? But it starts as three nerve roots, L4, L5, and S1. They come out from the spine and then they come together, and that becomes a sciatic nerve and it runs down the back of the leg. Okay, 1 to 2% of the population suffers from sciatica at any one point in time. Most commonly it's from a herniated disc in the lower lumbar spine or from spinal stenosis. Less commonly you can have nerve root irritation from degenerative disc disease, a tumor, or something that occurs after the nerve roots down along this area. When a disc degenerates, the outer layer can tear and part of the inner jelly can squeeze out. Okay, so just pretend that this is the outer layer and it has a tear in it and the inner part's squeezed out and it's pinching on the nerve root here. Okay, this in and of itself doesn't cause pain. Now what happens is it can get inflamed, which is why it's red, and that causes sciatica pain to shoot down that nerve root. Okay. What are the symptoms? Well, they're going to vary between patients, but it can be a burning type pain, electrical sensation, pins and needles sensation, possibly some numbness in the leg, possibly some motor weakness, and then rarely it can cause incontinence. That's actually a surgical emergency. How is it diagnosed? Well, usually it's a combination of history and physical, and then an MRI. So here's what are the tests? The pain doctor will lift up the person's leg straight. That's why it's called the straight leg raise test. And if the pain goes through the roof and then it alleviates when the doctor flexes the knee, that's because you're putting tension on the nerve root and then you're taking it off when you flex the knee. That is about 90% indicative of a herniated disc. And then when you see a disc herniation this large, that tells the rest of the story. If it's still unclear, a nerve conduction or a diagnostic injection may be necessary to figure out where the pain is coming from. Sciatica treatment, there's plenty of them that are non-operative. Limited bed rest. It used to be thought that a week in bed was the best, and that's not true. Anything over 48 hours is actually more detrimental. Medications may include anti-inflammatories, Tylenol, muscle relaxers, neuropathic medications such as Neurontin or Lyrica. Opiate medications may help relieve pain. Physical therapy can be beneficial along with chiropractic treatment. TENS units, such as you see here, are about the size of an iPod. They're battery powered, and slight electrical impulses go through these foam pads on the skin. That can help change the way the brain perceives pain signals. Acupuncture can be beneficial. Spinal decompression therapy is an intermittent computerized traction that's been shown to be over 85% effective. Interventional treatments can consist of trigger point injections, which are great to relieve spasms and aching. And then epidural injections, such as you see here, is where steroid medication goes right around the area of the pinching, okay? And that bathes it with a soothing steroid and can relieve pain for weeks to months. It doesn't fix the problem, but if it relieves that pain while this little piece of disc disintegrates, you can avoid surgery. Over 95% of sciatica patients are successfully treated without surgery. There was a large study back in 2006 in the Journal of American Medical Association that showed the one-year outcome between operative and non-operative patients was identical. So if pain relief can be achieved, non-operatively, the outcomes are going to be no different. The indications for sciatica surgery, if you have incontinence, which is cauda equina syndrome, that's an absolute indication you have to have surgery within 24 hours. If you're having motor weakness, like you can't lift the foot up very well, or the knee extension is a problem because of the pinching, and it's getting worse, that's an indication for surgery. If it's just not getting better, you can watch it for a while, but you don't want to watch it too long because at a certain point it's never going to get better, even with a great surgery. So that's something that should be a relative indication. And then elective indication is if you simply have pain and numbness and all non-operative treatment has failed for over 6 weeks, it can be considered to have an elective surgery. The top non-operative pain management for sciatica and all their other pain conditions is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today for treatment in the Austin area at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.